Welcome back to this We're All in This Together edition of Yankee Chronicle. I'm your host, Abby Peel. November is Lung Cancer Awareness Month, and 2 women from Wilmot who are non-smokers were diagnosed with this very treatable disease if it's caught early enough. Let's hear more.
Well, right now I think that research is so important in our area of lung cancer, but in all of lung cancer. Because of the stigma that has been attached to it historically, there hasn't been as much money going into the research of treatments for it. And as they're discovering some of these genetic types like ALK, they're able to develop targeted treatments for them. But unfortunately, these treatments right now, people develop resistances to them eventually, and they need to keep researching and finding more treatments so that we can keep going. That's the history of this is so interesting to me. That you too? I just can't believe it. So it was 12 years ago that they figured out what ALK lung cancer was. And they figured it out and they didn't have a treatment. And they had a treatment that they had developed for lymphoma that had an ALK genetic component. And that lymphoma treatment turned out to be a disaster for lymphoma patients. And so they decided to try it on lung cancer patients. And it actually works. And that's where we started seeing, people taking these medications and having dramatic results, like tremendous tumor reduction. And they extended the longevity of everybody so much with these treatments. One of the things we see universally with the friends that we've made who also have this disease is that it presents differently in every person, and you have to be really strong about advocating for yourself with your physician, so that, because both of us are non-smokers, we had none of the high risk factors for lung cancer, and we both have it.
I was not around secondhand smoke. And I just wanted to say that I think it's something like 90% of people with lung cancer are diagnosed late stage. So it's a problem in terms of diagnosis and not having those symptoms that are distressing. Well, I'd like to see better screening for people. I'd like to see more money in research. I'd like to see longer lengths of time for people with lung cancer, less stigma, whether you smoked or you didn't smoke. Everybody deserves life.
I think I would add that I would hope that they would universally screen for the type of genetic mutations that Sarah and I have, because that's so important in using these targeted treatments. And unbelievably, not everybody gets tested for that. But the way they figure out if you have these genetic mutations is they need to do a biopsy of your cancer tumor, and they do that using a bronchoscope. Once they take that biopsy, they test it, and they test the tumor material, and that's initially how they diagnose cancer. And then if they have enough tumor material, they can also look if there's any of these genetic patterns to the cancer. And if there is, then there's probably 9 or 12 of them that have targeted treatments that they can use.
I'm very pleased. I'm going to Mass General, and they're one of the leaders in the United States in terms of treating my type of cancer, Terry's type of cancer. And my oncologist actually does a lot of research, cutting edge research. She runs clinical trials, so I feel in very good hands. And that's one thing I would say to people is once you know your cancer, think about trying to go to the best practices possible, the best hospital possible to be treated, or at least use one of those hospitals as a second opinion.
So there's a organization called Longevity, and they're a charitable organization designed to extend the lives of people with lung cancer. And they allow us to set up our own individual donation sites. So through my Facebook page or through links that I send people, they can donate, and those dollars go 100% directly to ALK lung cancer research.
Thanks, Terry and Sarah. With fewer smokers these days, the percentage of those diagnosed with lung cancer has gone up. Be aware of the signs and advocate for yourself if you're concerned.